us in the story?
We're kicking off a 15-community tour of Northern Ontario, highlighting hospital-acquired infections. Every year, about between 3,000 and 5,000 patients will check into Ontario hospitals for procedures like hip replacement, and they will contract a disease like C. difficile, MRSA, VRE, and they will die from it. And the purpose of our tour is to draw public attention to the fact that many of these deaths are in fact preventable, and we're calling on the Ontario government to do a number of things to bring the death rates down.
Such as?
Well, we're asking them to require hospitals to report the deaths they have from these hospital-acquired infections. You should be able to go to a website and you should be able to identify how many people are dying at these particular facilities from these diseases to know if they're safe or not. We do this in Britain. We're asking that the occupancy rates, which are over 97% in Ontario, be brought down in the Netherlands and in the United Kingdom, where they're bringing the occupancy rates down and patients are not crowded together. In fact, the death rates have gone down significantly. And we're also asking for more resources for cleaning. Britain invested in a deep clean of their hospitals, and they've also invested in more cleaning staff and more infection control nurses, and that's also had a significant impact on death rates.
Now, the deep cleaning is very expensive, so how are you going to convince the province that this is worth the dollar spent?
Well, you know, at some point, somebody's going to launch a class action lawsuit on behalf of all of these family members who've lost loved ones to diseases that could have been prevented. And the cost of that would be much more than a deep clean of Ontario's hospitals. But losing one person where we could you know, make a difference, I think is something we should have a good conversation about.
So are we literally and figuratively just scratching the surface when it comes to cleaning?
Well, you know, our cleaners are doing a very thorough job, but these bugs are very resistant. The hospitals are overcrowded. People are lined up in ERs. They're sleeping, you know, in Sudbury and broom closets. You know, they're packed closely together. They are vulnerable. They have, you know, frail immune systems. They're susceptible to these diseases. They're contracting these diseases, and you know, over the years we have consistently cut back on our cleaning staff, cleaning resources in hospitals. Those aspects of budgets have been pared back. All the emphasis is on stuff like hand washing, but hand washing is not enough.
When we talk about deep cleaning and the fact that the occupancy rate is so high, how and when would they be able to do it, and what does it involve?
Well, the first thing we're calling on the government to do is not proceed with the planned closure of 5,000 alternate level of care beds, which they have announced. We've got a population that's aging, it's growing in size. We have the fewest number of beds per thousand of the population of any province in Ontario, most efficient hospital system, and we're calling on the government to put a brake on the closure of those beds. You know, as long as the occupancy rates are over 85%, you're going to see, unfortunately, many people die from these diseases who need it.
And the deep cleaning would involve?
Well, the deep clean would involve an absolutely thorough cleaning of every surface in the hospital. Because, you know, you can clean this room, and we're going to demonstrate for you how this room will be cleaned. But if the patient, as happened with SARS, if a patient leaves the room and goes to a nurse's station and touches a surface, then you can, as people did then, contract the disease from that surface. So, you know, the whole facility really needs to be cleaned, and nobody's made that investment.
From what you've heard, from whatever stats you have, is there an area in the province that seems to be a hot area for this? In other words, how does Northern Ontario compare with Southern, South Central?
Well, you know, you can go to a website of the Ministry of Health and you can see the outbreaks. They're required to report the outbreaks. Whether those outbreaks are being reported, you know, faithfully, we have no way of knowing. The Hamilton Spectator is running a series on outbreaks at St. Joseph's Hospital in Hamilton. You know, there were over 90 deaths at Burlington, St. Joseph's, Joe Brant in Burlington. So, you know, there have been ongoing cases of outbreaks that the hospitals have not been able to put a stop to.
Any in our area that you're aware of? And I'm thinking of the Sudbury, Sault Ste. Marie, Sudbury, North Bay corridor.
The Sault Ste. Marie Hospital has had a problem with outbreaks that's been tracked by the STAR. As for the other hospitals in the region, I'm afraid I haven't checked the stats.
And what do you mean the STAR?
The Sault Ste. Marie paper? Yeah.
Oh, okay, all right.
So we have another couple of people, a nurse and a cleaner.
Perfect. Yep.
Thank you.
Sherry,